Hi, Dr. Tesema. Welcome to this Fireside Chat. My name is Suleiman Yakubu. I'm the Monitoring and Evaluation Lead with the Power of Nutrition. We're conducting this Fireside Chat series as part of Power of Nutrition's ongoing impact and learning exercise, in which we invite leading experts from the nutrition sector to share their insights and learnings learned with the wider nutrition sector. We're doing this important learning activity as part of our ongoing 10 years anniversary celebration of the Power of Nutrition. The Power of Nutrition was founded 10 years ago, and ever since we've had remarkable experience implementing high impact nutrition interventions. And also most of these learnings through the evaluation that we've conducted as part of our Power of Nutrition's 10-year anniversary would be collated and also documented in a very good impact report, which we hope to share with the sector as part of our learnings. So I really welcome you to this particular fire chat, and looking forward to having an engaging discussion with you.
Thank you so much, Suleiman. Indeed, congratulations for 10 years anniversary. My name is Dr. Masrasha Tasama, and I work for Ethiopian Public Health Institute, and I'm Director of Nutrition, Environmental Health and Non-Communicable Disease Research Directorate. And thank you so much.
Yeah, thank you very much for joining us. And we've really appreciated the collaboration with the Ethiopian Institute of Public Health over the years. And just to provide a background of why we're doing this important fireside chat today, our conversation is really going to be based on Power of Nutrition's localization efforts to engage with national governments and reputable national institutions like the Ethiopian Institute of Public Health and other organizations as part of our efforts to ensure that and also demonstrate that it's very important to engage with national stakeholders, community-based organizations to improve localization of and delivery of international development aid efforts, but more importantly, making sure that there's local ownership and accountability. So I think that's really essential that we're having this conversation around all what we've learned and what opportunity exists for other stakeholders within the international development aid sector to learn from this approach.
Yeah, and thank you so much for this brief explanation about the work that you are doing. So in terms of myself, as for you, I'm the Director of Nutrition, Environmental Health and NCD. I do have several roles in my current position, in particularly, leading the national nutrition research, in particularly research that is more related with policy and programming, particularly implementation research. And most importantly, most of the research which I personally engage or my teams engages, to support the national food and nutrition policy and the strategy, in particularly to making the evidence, based decision by policymaker. And most of our research also helps, to change a policy as well as a program, in particularly improving the lives of many children in Ethiopia. And most importantly, also my roles, I have international as well as a national partnership and collaboration, where nutrition is multi-sectoral. We cannot do nutrition work by a single sector. So I do have a lot of engagement on, partnership, in the country and outside the country, also makes that the country has, adequate implementation with multi-sectoral partnerships abroad and as well as in the country. Over to you.
Yeah, thank you very much. I think I like the points that you've raised. It really takes multi-sectoral collaboration to deliver an essential intervention like nutrition. But more importantly, I think you've really emphasized the role of community, by also engaging with local communities to get their buy-in and also their support with delivering these interventions. So I think this brings us really nicely to really, look in-depthly about the product access initiative, which is the main focus of our discussion today. the Product Access Initiative is a groundbreaking innovation that the Power of Nutrition conceptualized in collaboration with national institutions, reputable national institutions like the Ethiopian Institute of Public Health. But also, this innovation started in Liberia with the University of Liberia School of Public Health and other local organizations like the Ministry of Health in Liberia and community-based organizations. So the goal of the Product Access Initiative, like you're aware, Dr. Tosama, and also other stakeholders, for the benefit of other stakeholders, is to really use quality data for program improvement and also to inform policy change, but also improve implementation and delivery of essential interventions like nutrition. And over the years, I think we've learned, a lot of learnings and insights from implementing the Product Access Initiative, both in Liberia, but also in Ethiopia. So I'll just hand over to you, Dr. Tosema, to share your perspective around how the Product Access Initiative has gone in Ethiopia, but also some of the key learnings we're beginning to see through the multi-sectoral collaboration and multi-country collaboration with Liberia.
Yeah, thank you so much. I think before that, in terms of international organization, in particularly collaboration with the local actor to bring a meaningful change, and there are key lessons that we have learned through the process which we are working. One of the most important, learning that we had is we need to build a very, trustful collaboration and partnership with a local actor, which we have that experience from our collaboration. And the second one, also building the capacity of the local institute is also very important in terms of, building the right capacity building in the local to deliver this. And the second one, also most importantly, many international organizations sometimes may miss is engaging the local actors, from the inception is also very important, which that would help us in term one would be the sustainability, where the local partner can take over these activities if they are engaged. And the second one, also the ownership is also come when they are only engaged in the inception of the projects. What do you?
Yeah, thank you very much. I think I like the way you've really spoken about the implementation of the Product Access Initiative in Ethiopia. I think from the initial design of the project, there has been this hand-holding and also engagement with reputable national institutions like yourself, but also the engagement of community members who've found their insights to be very valuable in the design. But also in terms of the actual data collection, we've seen that collaborative efforts with the community members to help identify cases of malnutrition, but also help that being part of the dialogue in terms of what can be done to really improve access. So I think it's really good to see the support of local actors.
Yeah. So one of the lessons also from the Product Access Initiative were in terms of addressing the local needs, especially on target population is, from the experience that we had with the Product Access Initiative, and our intervention has potentially improved, the child treatment. One of the evidence is, the treatment coverage of severe acute malnutrition has been improved from 30 or 33% to over 53%. This is something, a very great achievement that we have seen. And similarly, also, we have seen that the moderate acute malnutrition has been improved from 20% to almost half, or 48%. So this treatment coverage improvement has come, to addressing the local need. We have identified those local need identified through this initiative. That's what we have learned. So I think, this is a way how, addressing the local needs sometimes, especially understanding the demand side and the community side is sometimes, not easy. And in terms of service delivery, also the quality of service delivery, you can only know that if you could have, adequate, or evidence-based intervention, that you could understand what the community's challenge from various perspectives.
Yeah, thank you very much. And just to expand and build on the very good points that you've made, I think we've seen the role of how the Product Access Initiative has been very useful for the nutrition, delivering nutrition interventions in local communities, particularly underserved communities where the issues are really severe. But also, we see this particular innovation not just being applicable to nutrition, but also other high impactful interventions like vaccination. And I think some of the learnings we've seen from collaborating with your institute is how this is really multi-sectoral, like you said from the beginning, how innovation that is applicable to nutrition, because it involves data, can also be applied to immunization. But more importantly, I think that can also be scaled up to other essential primary healthcare services. So, which is the beauty of the innovation. It really applies, and we've seen the support of local communities being a big part of this and being at the center of this particular innovation.
Yeah, thank you so much, Suleiman. And indeed, I do also agree that, I mean, this initiative or innovation could potentially applicable to other service delivery in the health system. For example, it would be applicable to immunization and family planning programs and other also, programs, including, for example, in our study also, we try to address the supplementation program. So it has some innovative component which we can address, or include this intervention to other programs in other settings. So there is a greater ways of learning this intervention or initiative to other initiative in the health system, in particular to improve the service delivery or the service coverage.
Yeah, thank you for the good point. And I think you've really framed it well. So I just have another big important question to follow up on. In your opinion, I think what's the role of data in all of this?
Yeah, I think data is very important. Unless data, I mean, what we have, learned from the product access initiative is data, the role of or the importance of data. Unless, the data or the quality data, it's wastage of time and resource will be wasted and a lot of duplication. So for us, data is very important. The cornerstone in terms of especially improving the nutrition program, service delivery, and the data, especially at grassroots level, at the community level, quality of data is very important. Where we need to strengthen this data, unless the data is the decision that we are making is something wrong decision, and that would also mean that we are not saving the lives, we are not improving, we are wasting our resource. So the role of data is beyond that quantitatively that or statistically measuring. It has a greater implication in terms of changing the lives, and also, I mean, in terms of using the resource in the right ways, in the right appropriate ways, and for whom that resource to be allocated, for whom that's resource to be used and not to be used.
Yeah, thanks. I think you framed it really well. Data is very essential, particularly quality data. It helps stakeholders like yourself in collaboration with national government, but also the community members to understand the progress that's been made, both positive but also negative results. I think that's where quality data really comes into play. But more importantly, with quality data, I think we can help improve our implementation strategies to ensure that we're targeting the right population. But also, if there are communities or beneficiaries that are missed, who are not getting quality nutrition interventions and other healthcare services, I think we've seen the role of quality data to help us identify those populations and make sure that we're bridging issues around inequality and inequity in communities. So really, thank you very much for framing that. As we come towards the end of this conversation, I think we'll just look at some of the critical learnings that we've learned, but also around the role of localization in strengthening nutrition through evidence-based policy to really guide implementation at scale. And one example I like to draw on is really the multi-country collaboration with Liberia. particularly looking at the comparative analysis. We're currently conducting for this particular exercise, which is going to be published in a reputable journal like we're currently working on. I'd just like you to share your thoughts on that level of collaboration, and also what you think can be helpful in both countries that have similar experience.
Yeah, this is a greater way of learning with University of Liberia, in particularly University of Liberia ahead of us or Ethiopian Public Health Institute. There is a greater learning exchange of knowledge and experts. And I think also what, both countries use the same method, and to somehow also both countries are on low middle income country, where to somehow the problem is also the same. I think we are now working in terms of joint publication, which would be very strong and go to the big journal, how is high impact. And with that also process, we have been learned, to somehow writing together and sharing the activities, and this is a greater experience, and which in the future also we like to expand such kind of experience and learning, and also publishing, jointly rather than publishing country-based publication, which would be gives some to somehow powerful message to the global community in terms of using these tools, meaning the power of the product access initiatives. So with that, I really appreciate the power of nutrition, how you coordinate the two countries and work together and facilitate this the calls, joint writings and so on. That would be, something which we have learning and also continue learning through this process.
Yeah, thank you. I think that was a good explanation of really what's going on. I'd like to understand what your call to action to the nutrition sector would be, particularly looking at localization, but also the use of data and evidence gathering for quality implementation. What will be your message to the sector?
Yeah, I have several points in terms of call to action. The first one is, nutrition issue is complex, which one sector could not address. Strengthening the multi-sectoral collaboration is very important, and engaging especially the local community. So we need to have an excellent ways to strengthen or enhancing multi-sectoral would be the first call to action. The second call to action is improving the data system. We need to build strong, the routine surveillance data, which could capture those cases. And also in line with this also, we need to have use or leverage, the AIs or the recent technologies in terms of improving the nutrition will be the second call to action. And the third one will be strengthening the health system service delivery. This requires optimization of health extension workers or the community health workers, building their capacity, providing some kind of self-training and incentive, which is very important in terms of improving the nutrition. And the last one also, building the capacity of local implementer. We have been said a lot at national level, many countries, including Ethiopia, the capacity is good. But when you go to the lower, at subnational level, at the community level, the capacity is not as expected. So building the local capacity at subnational level, at the community level, who are on the real implementation is very important. And lastly, also, we need to have sustainable ways of resource mobilization, resource to nutrition. And nutrition is very fragile. If you have conflicts, if you have, insecurities, and that would be due to man-made or, natural, it's very fragile. So we need to have, a resource that could, entertain in all times. So we need to have that mechanism at the global level, at the country level also. Thank you, and over to you.
Thank you very much. I like the call to action that you've made, but more importantly, I think I like the last point you made about improving resources for nutrition, particularly mobilizing domestic resource allocation, but also in collaboration with global stakeholders to ensure that there's adequate resources by strengthening capacity of community-based organizations, particularly community volunteers and other community healthcare extension workers, to have the right capacity to deliver nutrition interventions, but also other essential primary healthcare services. So I think, in a nutshell, we've seen the role of data to inform all of this action. So we would like to echo this message to the global stakeholders to really draw from the learnings of the Product Access Initiative and make sure that there's the right resource allocation, both at a global level, but also at country level, to ensure sustainable delivery of nutrition services.
Thank you. Indeed, I do agree also.
Yeah. So thank you very much, Dr. Masharasha, for your time. It's been really engaging and listening to your point of view, but also having this interaction with you. And more importantly, I think it's been really nice working with your institute and learning from the work that you do. And I'm looking forward to collaborating further.
Yeah, thank you. Thank you so much, Suleiman. Also, I'm so grateful for the power of nutrition, for the leadership, and for a decade of action that you have made over the world. And in particular, your contribution in Ethiopia was great. And we really acknowledge that as government of Ethiopia, as institute individually, also that has been a greater contribution. And we look forward also working with you and the teams in the coming years. Thank you so much.
Thank you for your time.
Thank you.